Every year, October 10th is set aside to mark the World Mental Health Day, a significant event aimed to shed light on drug abuse and reduce the level of mental health disease. According to the World Health Organization, statistics released in January 2022 says over 20 million Nigerian youth are currently suffering from various degrees of mental illness or disorder without psychiatric care. To join the world in celebrating the day, the Legend Support for Community Initiative, a non-governmental organization in Lagos State, organized a symposium with the sole aim of creating awareness campaigns against drug abuse to reduce the level of mental health disease. The event, with the theme "Mental Health is a Universal Human Right," saw dignitaries from all walks of life at the Ejigbo Town Hall, Lagos. Mr. Sulaiman Ijaoba, the president of the Legend Support for Community Initiative, emphasized the need for everyone, regardless of age and background, to have access to high-quality mental health care and support.
The theme for this year World Mental Health Day, mental health is a universal human right. However, there are several barriers to treatment for individual Nigerians, which include lack of understanding of the root cause of mental illness, lack of financial support to get mental treatment, lack of social support, and fear of stigmatization concerning being labeled as mental ill person. We all know that prevention is better than cure, and that is the main reason our NGO is marking the World Mental Health Day to create awareness about mental health. This is an important initiative to improve understanding of mental health condition and increase access to healthcare for those who need it. One of the key aspects of the awareness is to educate our teeming youth on substance abuse, which has adverse effects on their health.
The Divisional Police Officer of Ejigbo Police Station, CSP Mariam Shonubi, and CSP Dick Adoni, enlightened the students on drug abuse and misuse of drugs in the society, noting that government's kick against drug abuse.
They have the same negative effects as this other.
Students were advised to abstain from any kind of drugs that would damage their health and always speak up in any challenges faced.
The immediate solution to curbing drug use and abuse is awareness. To the students in schools, they should have a drug-free club. We call it a WADA club. WADA is War Against Drug Abuse. This club is meant to fight drug problem in their midst. And it is our belief that when students talk to themselves, it gives so much meaning. Like as a young one like me, I'm talking to my fellow, they get it more. So it is very important that they have a drug-free club in their schools. And community-based, just like what is happening here now, I must tell you that I appreciate the organizers of those programs. It means that they value life. Anybody who is talking to students or to young ones and young adults on drug use and abuse has value for life. When you look at what is happening, somebody can just be walking on the street and just drop dead as a result of drug use and abuse. So there's need for training and retraining of drug use, of drug sensitization.
Yeah, one of what we do is what we have just come to do today, sensitizing, talking to people about it, and we place our surveillance around. When you found culpable, you are taken. Some of the kids are taken to correctional center. I have some in Adigbe, those that we found culpable around the local. And Lagos State government is really trying to make things easy for us these days. We keep sensitizing, we keep monitoring, we place surveillance, and we make arrests. If we need to take to narcotic, we do. There are some we can take to correctional center where they can be talked to.
Dr. Akinola Olufunmilayo Eniola explained that the most challenging mental health issue in Nigeria is stress, stating that attempted suicide is a crime.
Adult psychiatric illnesses actually started in adolescents around the age of 15. So if you can get to these children now, let them know how to identify it, how to take care of themselves, so that even if they have problems, they can seek treatment on time, so that by the time they get into adulthood, obviously they won't break down completely to have a psychiatric illness. So all of us must understand and accept things happen. So when things happen, what is the solution? So when all of us are talking about it, we'll be able to reduce the stigma and the discrimination. So the theme for this year is that the mental illness is a human right. All of us must have access to treatment, and we must not be discriminated against when people have mental illness.
We have actually not been getting much support that we expect from government. That is not to say that some of these government agencies have not been supportive. For example, the event we are having today, we have officials from NDLEA, you understand, which of course is a government agency, and they are here. And we equally have a consultant from the Federal Neuropsychiatric Hospital, which is equally supportive. A member of the Nigerian Police Force is equally here. So the government agencies, some of them have actually been living to their expectation. They have been supportive. But of course, we need them to do more, because the campaign on mental health, the campaign against drug abuse is not something an NGO can do alone. Of course, we need more support from the government.
Students applauded the organizers for putting up such an educational event.
The program was so interesting. I learned how to use drugs and how to use drug mentally and how to take care of our mental health properly.
I've learned about drug abuse and how to cure it, the symptoms, and kind of people, like how to report to the agencies responsible for drug associations, and how to cure and to stop drug abuse.
I would tell students, all the people that are getting involved in drug abuse, that they should actually stop, because it's going a long way. It's actually killing many people. They are actually taking many of them to psychiatric hospital because it's going a long way. It's really affecting them, and I'll make sure that I tell all of them that it's a very bad thing taking drugs.
While taking steps that safeguard mental health, the Legend Support for Community Initiative also renders selfless service in terms of capacity building, humanitarian projects, community development, amongst others.